We have 2 new outbreaks of the swine flu to report in this country. One of them has turned deadly.
Okay.
Let's go right to CBS News correspondent Nancy Cordes in Washington. Good morning, Nancy.
Good morning, Maggie. Well, we're still gathering details, but the CDC now confirms that a 23-month-old from Texas has died, the first death from this virus that has been reported outside of Mexico. We're also learning this morning that more cases may have popped up in Chicago, leading public school officials there to close at least one school. Now the White House is calling it an abundance of caution, asking for an abundance of money, asking Congress for $1.5 billion to help develop a vaccine, boost antiviral stockpiles, and monitor the outbreak. Maggie?
CBS's Nancy Cordes in Washington. Thank you for the update. Here now is a look at how the virus has spread around the rest of the world. We're also seeing new cases this morning in Germany, which brings the total of countries affected, including the U.S., to 8. The disease has killed almost 160 people in Mexico, where it began, with almost 2,500 more believed to be infected. And as we reported, the headline this morning in the U.S., there has now been 1 death, and 5 others are in the hospital. There are 66 confirmed cases spread across 6 states. Harry?
Joining us from Atlanta is Dr. Richard Besser, acting director of the Centers for Disease Control. Good morning, doctor.
Good morning.
Yesterday, you talked about that we could expect deaths with this flu epidemic that is spreading now. We now have reports of that first death. What do we know? What should we be learning from this?
Yeah, unfortunately, this morning I do have to confirm that we have the first death of a child from the H1N1 flu virus, and this is in Texas. 23-month-old child, and the health department in Texas is going to be sharing more details with this later this morning. A death is tragic whenever it occurs. As a pediatrician and as a parent, it's especially tragic in a very young child. Flu is a very serious disease, and we're treating this outbreak very seriously and taking aggressive action to try and control this.
Let me ask you this, because there's been now a sort of a blowback. People are saying, well, there's too much coverage. It's creating panic, everything else. Help us understand why you're trying to isolate this disease and stop its spread.
There is a lot of concern around the country and around the world, and we're very concerned about this. And it's our goal that people take their concern and they channel that into planning and they channel that into action, because there are things people can do to limit the risk to themselves and limit the risk to their family and to others. And those messages are critically important, especially early on in a new emerging disease outbreak.
Because the reality is we have no idea if, in fact, this same flu, which we're now calling H1N1, is that correct? As opposed to swine flu? Okay.
Well, the issue of names is an important one, and I don't know what we will eventually call this. But it's important that names don't lead to inappropriate behavior.
Understood.
This is not transmitted by eating pork. It's not transmitted in that way. It's transmitted like other respiratory viruses in general through hands and through respiratory secretions. And so our measures to control need to be directed in that arena.
But this disease has had a lethality in Mexico that it hasn't had in the United States, even though there are many, many more cases in Mexico. Help us understand why that is. Or do we really know?
Harry, that's a critical question. And we have teams on the ground, tri-national team in Mexico, working with Canada and Mexico to try and understand those differences, because they can be helpful as we plan and implement our control strategies. And it's too soon to know the difference. There's lots of hypotheses and ideas. But whenever there's a new virus, it's unique. And you can learn from history. But if you put too much on previous outbreaks and how they've gone, you may miss something when something new occurs.
And the real sin would be to underestimate it on the front side as opposed to having to really have to react to it on the back side.
Our approach is to be aggressive up front, take strong control measures, and then readjust. Okay. And if we need to take stronger measures, we will. If we need to back off, we'll recommend that as well.
Dr. Besser, thanks for your time. Do appreciate it.